With Dr. David Kennedy. David's one of our longest members in the organization. He's very passionate. He's led this organization as past president. And he is a wealth of knowledge. He's one of my mentors. He's taught me to be safer and healthier as I practice dentistry. You want to spend as much time with David at this meeting as you can. Anything, questions you have, he will gladly sit down and talk to you and give you his knowledge, which is vast. His brain's like a computer. He can quote studies, dates, where they're published and who published them. It's just unreal, the vast knowledge he has. Now, he can be a character too. So he's going to talk about fluoride. He's probably one of the most knowledgeable people in the country about fluoride. So it's my pleasure to introduce you to Dr. David Kennedy.
Thank you, Joe. So I have a couple of announcements to make before we get going. And if you want to have the wireless access work on your stuff in your room, in this room, you select Grand Ballroom Wireless and you put in the pin 8288V as in Victor. So now you can have Wi-Fi for less than $10 a day. In addition, because these are Academy of General Dentistry, they have a disclaimer that I need to read, and that says that I do not have any financial interest of a product in my talk or with any of the companies offering grants, monies for this continuing education, medical education program. And but I'd like to, so if anybody's got any offers, they can send them to me right now. I'm going to try to lay the groundwork so that you understand what the International Academy of Oral Medicine and Toxicology is all about. That's why we call this the fundamental course. And as Joe mentioned, I was at the very first meeting this academy ever had in Colorado in 1985, and I've attended every single meeting they've had since, even in England and Germany. So I've been there, and Joe was talking about the scientists and being able to recite. One of the things that we've done is we've had the people that published something that was interesting come and present their research. Here's what I did, here's why I did it, here's how I did it. So I don't have to say, oh, that was done by Boyd Haley in 1987, because I met Boyd in 1989, and he described what he was doing. And he was using acrylamide gel electrophoresis and showing, the band changes in the Alzheimer's brain and showing how you could create the same kind of damage with mercury, yada, yada, yada. And the whole audience looked like blank, because I have a degree in biochemistry and I was a medical technologist for 4 years, so I understood what he was doing. But if you went to dental school, I mean, how many times did they talk about acrylamide gel electrophoresis in dental school? Like, never. But we all learned that there are profiles we can see, and it's measurable scientifically. So science is about numbers, and it's not about proclamations, and it's not about somebody saying something and not backing it up. So that there are certain guiding principles that the Academy wants all of our members to understand, take it into their heart and say, is this the approach I'd like to take? That's the first thing you have to ask yourself. Am I comfortable in my heart with this approach? And so here's the approach. And you've all sworn an oath to uphold this. The first sentence is from the Hippocratic Oath. First and foremost, do no harm. Is that an approach you would like to take? Hippocrates would not allow any student to study underneath him. It was a tutoring education system at that time, unless they would swear that they were in favor of using no snake venom, no poisons, no toxins. They were using those 2,000 years ago. And that if you are a follower of Hippocrates, you swore off deadly drugs, poisons, snake venom. And the caduceus, why do you think it has the snake wrapped around it? Snake charmers, snake venom, was the name of the game for many Yeah, it still is. Decades, years, centuries, for one branch of medicine that they use powerful drugs to treat disorders. So first and foremost, do no harm. The second is we're using modern risk assessment tools so that we can make future choices for ourselves, our office, our staff, and our patients. Choose wisely. What's risk assessment? You measure the impact of a substance on, hopefully, an animal, and then extrapolate from that a safe amount that causes no physiological change. Is it risk assessment? And it's like one dentist that I was talking with says, I haven't seen anybody die. And I said, in a risk assessment, death is a very, very blunt endpoint. Is that if I exposed everybody in this room to exactly the same amount of a deadly poison, some of you would die, and some of you would not. So how the heck do we figure out from death as an endpoint? And those kind of experiments will get you in trouble pretty quick because, boy, you can't be doing those kind of experiments that cause people to die. So risk assessment uses a combination of multiple sources of information. The first thing to do is you look at the molecule. Does it have the potential? What kind of energy does it have? What's it likely to do? You look at bacterial studies where you mix it into the culture with bacteria to see what happens to the bacteria. You put it in animals to see what happens to the animals. And then you look at epidemiology to see if there's any evidence it's happening in humans. Of those tests, the bacterial test is the strongest. People don't understand that. Even the courts in the United States think epidemiology is the strongest. It is not. It is the weakest. And the reason is that humans go out and they fly airplanes and they smoke cigarettes and they ski down mountains and they do all manner of things. Some of them drink aspartame, others drink NutraSweet, others are taking Lipitor. And so the epidemiology research is the weakest of those things. You need first the lowest level of evidence. What does this molecule do? Then what does it do in the presence of vital organisms like bacteria? What does it do in a relative animal like a monkey or a rat or a sheep? And then you can look at epidemiology and see if there's any evidence that some of that you saw in these others is occurring in humans. So that's called risk assessment. And so when you find evidence of harm, especially in the human population, what you do is you put, depending on the harm, if it's a low-level effect, you put a factor of 10 to move it to a no effect level. And because we're all individuals and there's babies in our society as well as geezers, you put another factor of 10 in there unless you have measured the impact. So when you find a level at, say, 1, and you were blind to the rest of the effects, you put 2 zeros in it, so it becomes 0.001. And that's standard EPA risk assessments, United Nations used throughout the world in risk assessments. That's one of the things we use to evaluate materials that we're going to use in our patients, or we have people talk about it and talk about risk assessments, et cetera, et cetera. So this is stuff that I've learned since I graduated in 1967. We didn't even know the terms. This is new stuff, but it's all the stuff that happened from the 70s on when Herbert Needleman found a drop in IQ from minuscule amounts of lead. Levels of lead in Wichita, Kansas in the water of 50 parts per billion. That's the B word, 50, which was the EPA's level that could be in water, and now the desired level is 0. And so the water can be sold with 15 parts per billion in it, the B word. But before Needleman's study, and even after that study, the argument was, well, nobody died. I didn't see anybody dying. Yeah, did you see some children that were having trouble in school? And so death is too blunt an endpoint, and so you need to be able to measure and look at the changes within the physiology of the human being to make your choices. And then what always happens, invariably, is that when a new issue comes up, and trust me, there will be new issues. Stuff that we haven't even thought of yet will come up. When new issues come up, advocates, or perhaps people that are taking an opposing point of view, will say, well, all the research shows that, this is a perfectly safe procedure. And say, oh, do you happen to have a copy of that? Can you show me that? All research that you're referring to? Because I haven't seen that. I would really like to review it and maybe perhaps talk to the author and have him speak to the Academy, because show me the evidence is our motto. Show me the evidence. If you're going to tell me that there is evidence contrary to our point of view, we will show you our evidence. I'll show you yours if you'll show me. I'll show you mine if you'll show me yours. I probably shouldn't show you yours. But anyway, might get in trouble there. I just had to say that so that you understand what we're trying to tell you. We're not trying to take stuff away from your practice. We're trying to give you the tools to make your practice a magnet for people who desire health-centered dentistry. So if you're smoking, drinking, I think of one of my colleagues in San Diego that I would say he was a party dude surfer. He just was a wild man. You could find him any afternoon at the bar, any morning on his surfboard, and during the day in his dental office putting in mercury fillings or crappy cement or whatever. But he was a crazy guy. I wouldn't have him fix my toenails, much less my teeth. He wouldn't be interested in the Academy at all. That's not his lifestyle. His lifestyle is me. So he's out there taking care of him. But on the other hand, some of us got into dentistry because we want to make it a better place for people to come and have health. And so that's what the Academy is about, is to give you the tools so that you can sit in your own office and arrive at conclusions, or you can access the 500 members that are willing to mentor you who have been doing this for 30 years and say, oh, you ran into this. Well, I'll tell you what, if you run into an issue, 100 of us have already run into that issue and figured out how to get around it or work with it. No question about it. So we're here to help you, and I'm going to hurt you a little bit. I'm going to have to take away your profound belief in what the person in front of your class in dental school taught you. Because what the lecture point of view that we use in dental schools and medical schools says that the professor's right. And when I was in dental school, I had a degree in biochemistry before I went to dental school, and the guy that was teaching biochemistry didn't understand the Krebs cycle. Krebs cycle is fundamental to the way your body generates energy. He had it wrong. He didn't understand it. And he kept lecturing on us, and we kept trying to, professor, and he would shine you off and shine you off and shine you off because he was just making his salary. And finally, wasn't myself, Norm Whately, who was a PhD in pharmacology, also understood that the professor was completely cranial challenged, carried this big, heavy biochemistry book to the class and opened it up and put his finger on the Krebs cycle. And so when the professor went off the rails, he said, Professor Bozo, the book says, he never got the rest of the sentence out because the professor said, oh, go with the book. So that became our motto, go with the book. So not everything in the book is correct, though, but go with the book. So one of the things that, how come we're not doing it? There we are. One of the things that you are in is a situation where you are more or less not given the true facts about anything. Here's an example. This was in Japan, where they killed a bunch of people on a train by mixing two ingredients in a bag and leaving it on the train car, and they killed hundreds of people. And they reported that they had made sarin nerve gas, yada, 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 yada. Does anybody know what the only active ingredient in sarin is? Fluoride. That they tried to import fluoride into Iraq, and they were stopped by international sanctions because they were importing the ingredients to deadly weapons of mass destruction. What was it? Fluoride. So they don't tell you, by the way, it's one of the most active compounds in the whole periodic chart. It will extract electrons from the inert gases. It is a deadly poison that will kill anyone and anything. So would be nice for them to explain that in dental school. In my book, we talked about a child that went to see the dentist for the first time. He was 3 years old, and the hygienist was busy talking to the dental assistant about her new nails and this and that, and she did a little topical fluoride treatment on the kitty, and yada, 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 yada. Handed the little kitty a glass of water. Well, what does a 3-year-old do when you hand him a glass of water? Drank it. And, oh, you dumb kid, you drank that. And so they sent him out to the waiting room, and mother said, what did you do to my kid? She started throwing up. The ADA says that fluoride can't be a poison because it makes you vomit. Anybody ever do a topical fluoride treatment in your office and have somebody vomit? I did. I wasn't always this smart. I used to be a lot dumber. And they say it's self-limiting because you'll vomit it out. Well, they didn't give that child care. They sent him downstairs to the pediatric office. The pediatrician was busy, so it took an hour to get to him. And when he got there with his stethoscope, you know what you die of if you're exposed to fluoride? His heart was down to 30 beats a minute. And so you die of cardiac arrest. It sucks all the calcium out of your blood and your heart's quit beating. So they squirted him full of adrenaline and did 911 and they transported him to the hospital. He died while they were trying to pump his stomach. This happens every day in the United States. It happens every day when they treat children under general anesthetics on welfare. They put in a bunch of stainless steel crowns and they do a topical fluoride treatment. They have a checklist of things that they can get paid for. And one of them is a topical fluoride treatment. Well, how do they knock them out? They use fluorothane. Did you know that the general anesthetic is a fluoride? Think of the name, fluorothane. It's a fluoride-containing anesthetic. It knocks your brain out. Fluoride is a neurotoxin. That's how it makes people go to sleep when you're going to operate on them. You blanked out their brain. And so some children die then. And they said, oh, it's really risky for these children with baby bottle tooth decay to treat them under a general anesthetic because they might die. They do die. But that doesn't mean you don't have to identify the cause of death. And the cause of death, they always write down as anesthetic overdose. Why? Because they find fluoride in the bloodstream. Well, what if the fluoride didn't come from the anesthetic? What if it came from a comatose baby having topical fluoride applied to their mouth while they're unconscious? And it ends up going down their gullet, just like the child in the dental office. By the way, the hygienist and the dentist testified in their malpractice trial that they had not realized that fluoride was a carcinogen. I'm sorry, wrong term. Fluoride was a poison. And nevertheless, the jury found them guilty, and the mother got a whole $500,000 because her dead baby. So I have a presentation that I give sometime is called They Say. And one of the things that I like to do is use the official publications of our United States government to show you that if you know how to read, not between the lines, factual statements, they'll have rhetoric about how wonderful it is, but when you actually read the statements, they're not really quite so wonderful. And this is 2001, the Center for Disease Control. Read that. Can you think of a more complicated way to say that the amount of tooth decay in society is not related whatsoever to the amount of fluoride in your enamel? Isn't that what we were all taught in dental school? Is that brushing with fluoridated toothpaste makes fluoride in the enamel really hard? Well, that was not true, apparently. And that when they say higher concentrations are not necessarily more efficacious, what are they talking about concentrations? Enamel as high as 1,000 parts per million, for example, the same level as in Crest before you open the tube, had no measurable impact. Would nice that they told you that, because that means you don't need it in your teeth, and that the predominant effect is post-eruptive, which means your teeth have to be in the mouth. These are the people advocating it, remember. I'm not saying this is a good idea. I'm saying this is what the advocates say. Post-eruptive and topical. And then they say your saliva is a major carrier. Let me see a hand. How many people in this room swallow their saliva? If you don't, you're from Texas. So saliva is a major carrier. Well, how do you get it in the saliva? Well, you got to slop that grass toothpaste around on there. And then the concentration of fluoride is not likely to affect karyogenic activity in your saliva if you get it from drinking water that has fluoride in it. There's no level of fluoride in drinking water that can have a topical effect. If you swallow it and it comes out in your saliva, it, according to the people that are advocating we put it in the water, that the amount coming out of your salivary glands does not have a measurable effect. Let's look at another gland that fluoride doesn't come out of. Mother's milk. It's even lower than the saliva, because that's what God wants the baby to be drinking. And she knew that it would damage a baby, so they don't allow fluoride to come out of a mother's body into saliva. But there is another element that the mother can die of a deficiency of, and there'll be normal levels in the breast milk. You know what it is? Iodine. Iodine is essential for your baby's brain development. If you want a smart kid that gets through college and doesn't turn into an idiot and run his car through the supermarket, get adequate levels of iodine. Can you kill somebody with iodine? I'm reminded of the fellow that had the Corvette, and he was going a little bit too fast and smashed into the bridge abutment and knocked his head off. And they took him to the hospital, and they pulled out his driver's license and said, oh, he's an organ donor. Well, you know, there's not enough brain left for anybody to survive this incident, so bring the organ harvesting team in, and we'll, we got a pair of lungs, we got a heart, we got some corneas, yeah, we got kidneys, we got stuff here. And, but, you know, the guy kept living. And he kept living. And he kept living. And the physician that was in charge, he said, you know, I've got dinner tonight, I've got stuff to do. And, you know, what do you have in the ER or the operating room that you might look around and say, what can I hurry this man's dispatch? And he went over there and he picked up the iodine, and the guy kept living. But the nurse called 911. The physician went to trial for attempted murder. So had he picked up the fluoride, it'd have been done. So can you kill somebody with iodine? Probably, but you'd have to hit them with it. So then what does the ADA say? This is from the Journal of the American Dental Association in 2000, John Featherstone. It was the cover story article. It says, importantly, that means that fluoride incorporated during tooth mineral development at normal levels of 20 to 100 parts per million, even in areas that have fluoridated drinking water or with the use of fluoridated supplements, does not measurably alter the solubility of that mineral, i.e. your enamel. Even when the outer layer is over 1,000 parts per million, incorporated when you're growing up developmentally, is insufficient to have any impact on acid solubility. So Bill Osmondson gave me this nice slide, National Institute of Health Consensus Development Conference, and these are the people advocating fluoride. And what did they say? Conclusion that for only 2 specific applications, fluoride varnishes in caries active high-risk individuals, fluoride-based intervention on individuals receiving radiotherapy. The evidence was rated fair. You know, you don't want to get therapy that's rated fair. No, it's not a good idea. Fair is like, maybe. And these were the only 2 applications. Well, so what do we get from our trade associations? Understand that the American Dental Association, California Dental Association are trade associations. It's like talking to the AFL-CIO, is that they represent the interests of the dentists and industry. They don't represent dental assistants, they don't represent dental hygienists. They represent dentists and manufacturers. So by their own statement, they have a huge conflict of interest, because if the manufacturer is selling their member a product that is inherently unsafe, can they be represented by the same entity? And that every dental school in the United States is accredited by the ADA. And so what you learn in dental school is what the ADA tells you. So when you went to dental school, you were sitting there listening to exactly what the ADA wanted you to hear. You weren't hearing science, you were hearing the ADA's opinion. Socrates taught their students the difference between evil and good. And good came from the Almighty, and evil came from us, basically, mankind. That the world is inherently good, and that it is eternal, and it's at peace with the universe. And that's what he taught his students. But he said evil comes in because of our interpretation of that, and that the way we express that is we express opinions. And he taught his students that the difference between truth, he said, since truth comes from the eternal, and it has always been true, and it always will be true, and since it's part of the universe that is true, it never, ever changes. It can't change because it's what the universe is made out of. It's made out of truth. However, opinions are what we've made out of it, and they change like the wind. And so when you see stuff flopping around, oh, this is really good today, and ooh, it might not be good that tomorrow. Roundup comes to mind. Oh, it's perfectly good. It doesn't cause any problem, and now the EU has declared it a carcinogen. Whoa, looks to me like we've got a change of opinion. So that means that what we were dealing with in the first place was not truth, but opinion. In our opinion, it's safe to squirt your weed killer on all your vegetables. The truth is, this weed killer tests out as being a carcinogen. Remember the bacteria? Put it in the bacteria, makes their DNA break. You give it in diets of rats, rats grow tumors. There's some really nasty pictures on the internet from some of the scientific studies. PETA says that they're abusing the rats. Or you could go to the grocery store and be abused yourself. Because if you're not buying organic, you're buying Roundup. So back to the fluoride that works, fluoride varnish. And that made the immediate past president, Griffin Cole, a little curious. And so one of the things that this is the Volunteer Academy. And I strongly urge you to step up and do your fair share, because the way we got all this stuff was not because we hired a consultant from Timbuktu to come in and research it, is because people sat around their own office and they said, you know, I wonder if that's true. And they went out and found out if it was true. And what Griffin did is he wrote the manufacturers, and he wrote the FDA, and he wrote everybody and their brother, and started asking a very simple question. We're going to take this product and paint it on a child's tooth. We're going to have dental assistants do it, sometimes school nurses do it, sometimes it's done in a field hospital situation, and all manner of situations that are, impossible to completely evacuate the product that you put in the child's mouth. And in addition, you intend to leave it there, so it's not really necessary to evacuate it because you're going to leave it, is their opinion. And he wanted to know, when did the FDA approve this product for intraoral use? And they didn't approve it. They approved a product called Copolite. Everybody used Copolite when you were in dental school? When you put an amalgam in, they had you paint the tooth with Copolite. That's to keep your teeth from turning gray and looking like, to keep the molecules of silver from migrating down into the dentin and the enamel and turning it gray, so you had ugly looking teeth. They did not approve Copolite with any varnish, or any model, any kind of varnish with fluoride added to it. And so the question comes to mind is, well, they've added fluoride, but it's probably just a little tiny bit, right? It's just a skosh or a dab. So when somebody starts talking about a little tiny bit or a skosh or a dab, you're not talking to a scientist. You're talking to a chef or a bartender. Because scientists talking micrograms, milligrams, millimoles, parts per million. And so varnish contains 50,000 parts per million fluoride. Your topical fluoride in the office is 15,000, and sometimes it's higher, and some cases a little bit lower. But this is thousands of parts per million. They don't know the daily dose that you gave that child. You don't know the dose that's given to the tissue. Some people want to say, oh, well, yeah, but it's only a quarter of an ounce that we're going to put on this child's teeth, and so that if we take the child weighs 60 pounds, so we divide that by the total dose. Well, that's like saying, I've got this 2-ounce lead projectile, and so it's just a little tiny dose of lead. But the velocity of it makes it more harmful. So what you're doing is you're putting a really concentrated amount in a very specific area. So it's illogical to divide it by the 60-pound child. You need to look at the dose to the cheek, the dose to the tongue, the dose to the tissues that are adjacent to it. And you also need to examine and see if there's any systemic effect. Speaking of systemic effect, that everybody, except the one dentist in Texarkana, has seen this in their patients, and it's called dental fluorosis. And my wife and I were invited by Sin Guofan, professor, chairman of the medical school at Shenyang, China, to go on a tour of the high fluoride areas of China. And I wanted to take pictures of dental fluorosis, and he said, would skeletal fluorosis be okay too? So yeah, I'm good with that. And my wife had a new digital video camera, which was the Sony 100, because she was a really good photographer. But it happened to look like a consumer camera. This is 1999. So it didn't look like state-of-the-art digital video. And so they let us into the country. At that time, if you showed up with a CNN hat and a digital video camera, they wouldn't let you in. They weren't allowing videos of their country because you might be videoing their military installations and telling the world about this or that or something like that. So it's a controlled country. I'm not saying they're bad or evil. I'm saying that they control the country. And that because of Sin Guofan's influence and our invitation, we were allowed to go. And by happenstance, we took a video camera. And so if you look at my documentary that we made from that, it's called Accidental Studios. Because we didn't know that camera would get right in 2 inches away from your face and take a really good intraoral video. And till we got there, and I was taking slides, and Betty had the camera up, taking a picture of us around with our army. We had 12 people with us everywhere we went. I funded it. And when I got home, the footage was so remarkable that I turned it into a documentary. It's on my YouTube page, David Kennedy DDS. It's called China's Battle with Crippling Waters. And why we were there was because the Chinese Department of Endemic Disease Control is trying to stop dental fluorosis, because they know dental fluorosis is the harbinger of skeletal fluorosis. And that if you get skeletal fluorosis, you can't work. You become impoverished. You end up being a burden to society, and you have lower IQ. You have multiple problems with your thyroid. You have enormous health problems that go from one end of your body to the other, and they have a whole program to remove that from their water supplies. They're not adding it, they're removing it. It's natural fluoride. So when people tell you, oh, it's natural, well, you know, arsenic is natural. Lead is natural. Mercury is natural. So natural is means it's an element. But lots of the elements in the periodic chart will kill you. So natural doesn't mean doodly to me. But as we get into the issue of water fluoridation, that's a man-made product. It's not natural. It's 17% fluoride. Did you know that? The actual substance they add to the public water supplies is 17% fluoride. So anybody who's really good at math is going, let's see, 17%. Now, that means that there's, to carry one, 83% something else. Gee, I wonder what that might be. Does anybody know? Well, some of it's sand, because the stuff they're putting in is hydrofluosilicic acid. So it's got hydrogen, it's got fluoride, it's got sand, but that only works it up to 24%. So we've still got about 76% something else, and what is that? That's a potpourri of other bad stuff. Mercury, cadmium, radioactive isotopes, lead. Well, how do they get all this stuff together? It's from, you saw this thing in the paper the other day about how the EPA was trying to fool with a dam at a mine by Durango, Colorado, and they turned the river yellow by all the coming out of the mine, and the fish died, and they wouldn't let the people drink the water for a while. And mining industry is a really, really nasty industry. Well, how could they possibly have all that crap stored? Because the United States does not regulate mining at all. You know, we just tell you to put a dam around it and don't put it in the water. And the fact that you built the dam adjacent to a waterway, we don't care. So the stuff they're adding to the public water supply is not stuff from gold mines, it's stuff from phosphate mines in Florida, Mexico, China, Japan, Belgium, and it is from the pollution scrubbers system. It is contaminated, raw, hazardous waste from the pollution scrubber system. And like, you're not really told the truth about stuff, that it not too far distant past, and 2 months ago, 3 months ago, that a truck carrying this wonderful elixir that all the dentists go and tout in front of city councils, using their reputation to tell the public how good it is for them, got a leak. And they called a hazmat team who came in spacesuits and dammed it up so that it couldn't go anywhere, and it ate through the concrete barrier. Fluoride eats through anything. It'll eat through stainless steel. It'll eat through plastic. It'll eat through glass. If you've seen some graffiti written on glass, somebody took your fluoride and in a squirt bottle and wrote on the glass with it. It is the most electronegative element in the whole periodic chart. It eats anything. And they finally had to dilute it to the point where it wasn't eating the container barrier, pump it up, and put it in another truck, and take it away. How did it get out of the first truck? They don't carry it around in a truck that has a stainless steel tank. They carry it around in a truck that has a 1-inch thick rubber bladder, they call it, and it's tire rubber. It's really heavy-duty rubber, and they change it every year because this rubber, when you take it out, it just breaks like a cracker. And the fluoride eats the rubber, but it takes it a year to do that. So they can truck it real fast from Florida up to your water supply and put it in. Or the stuff they ship over from China comes over usually in a dry form. And then, so they have two forms, wet feed and dry feeds. But how did this kid get funny looking teeth? He drank the water, it went into his bloodstream, it circulated around his body, and then if you're a dentist, you believe in magic, and somehow it migrated to his teeth magically and caused the harm there. But if you took an x-ray of his hand, it damaged his hand. If you took an x-ray of his femur, it damaged his femur. If you took the brain out of the skull, sliced it up, and looked under a microscope, it damaged his brain. Dental fluorosis, or as I call it, DF, because it's easier. Most, if you ever want to challenge people, ask them to spell hydrofluosilicic acid. Or even better yet, have them say it. I don't think we should have stuff in our water supply that you can't say. So, Pam Dembeston published this research, and was it done before they started putting it in the water? No, it was done in 2002. And they've actually run it down to the very enzyme that the fluoride poisoned. And it's called MMP20, or metallothionein proteinase 20. It's a very important enzyme in fetal development, brain development, joint development, biological growth and development. It is one of the most essential enzymes in a growing fetus. And so if you can see funny looking spots on teeth, I can guarantee you, and I will bet you $1,000, that given adequate research and examination of that individual's body, that there is abnormality in their joints and their bones. So is it appropriate for us to recommend that somebody absorb into their bodies a well-known poison? It's not a nutrient. I've had dentists tell me it was an essential nutrient. They're confused. 1979, the FDA published in the Federal Register, remove all references to fluoride as an essential or probably essential nutrient. Who determines what's essential and what's not? That's the FDA. And what they said was, there is no such thing as a deficiency state. They cannot create any disorder by removing that nutrient from the diet of an animal. That's how they determine, and you can't create a deficiency of vitamin C in any animal either, except humans and guinea pigs. That a rat makes his own vitamin C, but we've lost that enzyme. We've lost that ability. So we have to eat vitamin C. But if you take a rat, cut it all over, and throw it in a sewer, his body starts pumping out grams of vitamin C into his bloodstream, and he doesn't get infected. So put that in your little mind and remember that if you have issues on patients, find a good physician that will infuse them with vitamin C. There's never been a recorded death from IV vitamin C infusions. Never. And there's 450 cases of polio that were driven away by IV vitamin C infusions. Cathcart, 1949, before they had the vaccine. So vitamin C is good. Fluoride is bad. Put that in your little list of things to keep in mind. And unfortunately, this graphic is not showing up today. So this was from Heller, United States Public Health Service in 1987. Oh, look, what's the date on the publication? That would be, it was 97. Well, the study was done in 87. And what does it show? And I have to help you here. This is the level of dental fluorosis of 2 teeth in children in areas that have the lowest fluoride that they recorded. 0.3 was the lowest level, 0.3 or lower. So 14% of the children had 2 teeth damaged visibly. And then if you had 0.7, 0.3 to 0.7, it was 22%. At the alleged optimum level, it was 30%. And if it was above, at 1.2 or above, it was 41%. You know what this is called? This is called a linear timeline, dose-dependent graph. This indicates that the people in the communities are exposed to fluorides from the water supply, and that exposure is indicated by the increase in dental fluorosis. Well, this figure down here tells us almost more than this figure up here, because in an area that has no supplemental fluoride in their water supply, the only fluoride in the water supply is something that's there vicariously, because fluoride is the 13th most abundant mineral on the planet. You will never find fluoride floating around free. It combines with everything. So if you took up a shovel full of dirt and spread it out, I can't give you the percentage, but a percentage of that shovel full of dirt, a substantial percentage, is fluoride. What's it in there? It's hooked to the rest of the dirt. It's hooked to the sand that's in the dirt. It's hooked to the calcium that's in the dirt. It's hooked to the iron that's in the dirt. It's hooked to anything that's in the dirt, because fluoride is never free. It's like the palm queen. She's always got a date. So, I don't know what that is. Wake up here. Good morning. Here's one. So, this was a model. I'm Stone Cold Fox. Lovely lady, and she came to see me about getting her teeth fixed. I did not grind them down and put porcelain laminates on them. But her photographer just told her, is that if you want to make a living in this biz, you got to get those headlights fixed. And so she was making her way through San Diego State by modeling. And beautiful Asian woman. And so I pulled out my little bag of tricks and buffed that dismembered enamel off and layered on a microfill composite and buffed it down and gave a little shine to them. And we had her go get some pictures taken, and it went away. It disappeared. But I got to talking to her. I said, are you the only child in your family that has dental fluorosis? She said, yes. I have 6 sisters. And I was the only one that was affected. And I said, 6 sisters? So there's 7 daughters in your family? And she said, yeah, my dad's Chinese. He wanted a son. Now he can't get in the bathroom. But she says, I was born in San Francisco. San Francisco has been adding hydrofluorosilicic acid to their water supply since 1955. And she was born there, and she was raised there for the first 3 years of her life. How much of the 2 incisors are formed by the time you're 3? Not that much. So they moved out of San Francisco to a house in the country that was on a well. There's no fluoride in the water around San Francisco. So none of her sisters had any dental fluorosis. They also didn't have any fluoride in their drinking water. So I asked her if I could use her photograph, and she gave me permission, because she doesn't want this to happen to other babies. It wasn't pleasant for her, children making fun. In California, dental fluorosis is listed as an adverse health effect. The dentists like to say, oh, it's just a cosmetic effect. And so the dentist driving the BMW wants to say that, and I reach in my pocket and I pull out my little pocket knife. I'm armed and dangerous. I can clean my fingernails anyway. And I can take that knife and I scrape down one fender of that BMW, and I say, that's just cosmetic. We're dentists. We don't care about cosmetic injuries to others. But watch them holler about their car, huh? This lady's from Tucson. Understand that the classification of dental fluorosis does not include the color, because it all starts out white. When the tooth is under the gum and the gum is growed over the top, there's nothing that can get to it. I've seen every color in the universe. I've seen purple. I've seen green. I've seen brown. And the color is not part of the classification because it varies dependent upon the diet, and that all dental fluorosis turns darker with time because the foods we eat are generally not white. If they are, you're probably going to die of cancer. And so one of the things that people might not pay that much attention to is that the Journal of the American Dental Association, who has been covering their says that infants receiving substantial quantities of formula generally should use powder or liquid concentrate if the water fluoride levels are near the optimum level. Let me explain to you that if the water levels are optimal, that it would not harm the baby. And what they're saying is it will harm the baby. That's the people that are in charge of our education in this country. Say, don't give the tap water to the baby. And why would they say you can use the powder and the liquid concentrate, which need to be reconstituted with tap water, but you can get the ready-to-feed formula, and it's okay? Because in 1979, the Food and Drug Administration made all of the formula preparation companies move the preparation facilities out of fluoridated communities. That's why you can use that, because they calculated the dose, and the dose of fluoride an infant on formula received exceeded the dose that would cause harm. Not just dental fluorosis, but other harms. And this was from the 2005 CDC. It's too hard for you to see. I might put my slides on up for you to have, and you can use them in your own communities. I'm always happy to send you even briefer talks. But what this shows is that ethnicity is by white, black, Mexican American, is that they then say, oh, it's always very mild or not even noticeable. It's just a red herring that there's a problem at all, because nobody has. Isn't that moderate and severe? Oh, let's see. What kind of percentages do we have there? It looks like about 2% of the white population, 3.5% of the Hispanic population, and 4.5% of the Mexican Americans. Well, gee, golly, 1 out of 20, 2 out of 50 have teeth that I was showing you earlier, moderate to severe. And that's the CDC. These are the people advocating this. So when somebody says, oh, it's all very mild, and it's really mild, the model I was showing you is mild or very mild, depending on whether you calculate whether that's the second most damaged tooth can have up to 50% of the tooth damaged, and that's mild. So if I wanted to take my key over to your BMW and scrape 49% of the paint off in a random pattern throughout the car, I say it's just a mild scratch. So I made up a bumper sticker that fluoride is bad for babies. And it causes disproportionate harm. This is what the harm I just read to you looks like if you lay it out in a nice graph that people can see. This is what I call the masterpiece. And this is a handicapped lady in Santa Barbara that drew this picture. And I sometimes have Kinko's print out this in an 8x8 format, put it on an easel, and when I give a lecture, I have boxes of crayons and coloring pens and have all the people at the lecture color it in. What it shows is that when you put fluoride in the water, it ends up either in the car, the bird bath, the children's pool, it comes out of the sewage treatment plant into the river, it's on the surfer, it's on the vegetables in the ground, it's in the bathtub, how do you think we know scientifically that fluoride will suppress thyroid function? other than the more recent studies that are done in the National Academies of Science 2006, it was used in the 30s and 40s to stop overactive thyroid. What did they do? They had you take a bath in fluoridated water, and it made your thyroid quit functioning. It goes right through your skin. And I have a talk that I give, and you can watch this on YouTube. It's called Poisoned Babies, and it's Dr. Thiessen, who was on the National Academy of Science, and myself, and these are her graphs, using extremely conservative figures. No fluoride exposure from toothpaste, no fluoride exposure from sealants, no fluoride exposure from any source except water. Using the EPA data shows that in risk assessment terms, children are exposed, especially infants and small children, to levels well above the EPA's risk assessment level. Does anybody know what the reference dose for fluoride that the EPA developed is? It's 0.06 milligrams per kilogram. Do you know the difference between concentration and dose? The dentists, and I know you don't because I didn't, and I was bragging earlier about all my great education and stuff like that. I was ignorant of dose. You know that when we went to give people carbocaine, they said, don't give them any more than 5 capsules. Well, what's that? Well, otherwise you will exceed the dose that might cause respiratory effect. Well, let me see. If you got a 200-pound patient, is 5 capsules the same as the 100-pound patient? That's twice as much, because dose is always weight for weight. So when they tell you the dose of fluoride in the water is 1 part per million, they got their head completely up their rear, it's dark up there, and they can't hear anything, and it smells bad. Dose is not a concentration in water or any other sealant. Dose is the amount you absorb, the amount that gets into you. What is your dose of penicillin? They give you milligrams per kilogram. So whenever you want to talk about dose, you talk about milligrams per kilogram. And so when you look at milligrams per kilogram, the baby on the bottle at 1 part per million that weighs 8.8 pounds, that drinks a liter of formula a day, gets 0.25 milligrams per kilogram. The dose that the EPA has identified that will harm that baby is 0.06. National Academy of Science determined that babies that were exposed to with low in iodine that were exposed to 0.03. So if you think it like money, we're giving the baby 25 cents worth of fluoride every day, and 3 cents will harm it. How stupid is that? But when this hits the fan, who are they going to turn to? You think they'll turn to the CDC and say, how come you told? You think they'll turn to the Food and Drug Administration? How come you? No, they're going to turn to their dentist. So how come you told me this was a wonderful elixir that I should put in my child's mouth? Because we're going to take the flack for it, except I'm not, because I stepped up. Dentists have it. One of the things that mercury does is it causes shyness, resistance to change, inability to think new thoughts or synthesize ideas. And so I've had hundreds of dentists in lectures understand in their core being that this was a violent poison that they didn't want to have in their practice or in their patients' mouths. And yet the cowards would not step up at city councils. They would not step up in front of the rest of their colleagues because they were afraid they would be criticized. Do you think I give a crap if some liar out there criticizes me? Show me your evidence. When you've got evidence that giving a baby 25 cents worth of fluoride every day, when 3 cents will harm them if they're deficient in iodine, 5 cents will harm them if they've got adequate iodine. No, I just slap them around a little bit. They like it. And what they do is they criticize the source of the information. Oh, that Kennedy, he's the only dentist that believes that fluoride's bad. There are 800 dentists in this academy that agree with me, but you've also got the Holistic Dental Association, you got the American International Academy of Biological Dentistry, you've got the entire countries of Sweden, Norway, Finland, Denmark, down all the way to all of continental Europe, fluoride-free from the water. They may have you buy toothpaste, that's your right. That's a choice. You can buy a gun here too. You can't buy one in Sweden. But hey, we're proud of our free country. Are we mandating that people expose their babies to fluoride? Yes, because poor people can't afford to go buy the ready-to-feed formula because it costs more. So we're mandating that people expose their children to a known poison for which, let me show you, this is the only study that's been done in the United States that has been broad-based and blinded. Not a perfect study because they could have had more children, only 39,000 children. Remember, we're exposing 100 million children to fluoride, and you only got a subset of 39,000. So that's kind of a weak subset if you look at the numbers. Two, the National Institute of Dental Research did this study, and they bragged in their press release that water fluoridation had reduced tooth decay tremendously throughout the United States, and their new study showed that. And so they were sued under the Freedom of Information Act for their data, and they refused to release it. Do you know what you know about a scientist that refused to release their data? Every scientist I know is happy for others to examine their data. So if you want to hide your data, you're not engaged in scientific research, you're engaged in political foolery. And so the court ordered the National Institute of Dental Research, now known NIDCR, I can care what their abbreviations is, I know what they really are in their core, to release the data on dental fluorosis and tooth decay. And they said they'd lost the dental fluorosis data. The court said, well, if you've lost the data, then I can't force you to release that. But they had the tooth decay data. Here it is. It took an army of volunteers to go through the data. There were more than 39,000 data points. There was no statistically significant difference in tooth decay, regardless of the amount of fluoride in the public water supply. None. And they still are citing this study as proof that fluoridation reduced tooth decay 22%, because if you take the children in the unfluoridated areas and compare their tooth decay at age 8 to the children in fluoridated areas, there is a slight glitch in the data that shows the children in the fluoridated area have a slightly lower incidence of tooth decay that goes away by the time they're 17. Hardy Lineback, who spoke to our academy, pointed out that the study did not adjust for delays in tooth eruption. What happens if you suppress thyroid function? Your brain grows at a slower rate. It used to be called cretinism. That's not a politically correct term. I'm not sure what the new term is for shrunk brain. But if you inhibit the growth of the brain, you also inhibit the eruption of the teeth. It occurs not only in humans, it occurs in rats, it occurs in cattle, it occurs in a wide variety of mammals. And so what they did is they managed to look at the data, find some noise, and say, see, there's a benefit. But did they do what every scientist worth their salt has to do, is to calculate whether the difference was significant. And so the statement is, and this is a precise wording that has, in 3 different court cases, has been determined to be a truthful statement. There are no broad-based blinded studies of animals or humans that has ever found a significant reduction in permanent tooth decay from the addition of 1 part per million fluoride to the public drinking water. And you will go to a city council meeting and the dentist will say there's thousands of studies. And you know what you're supposed to ask them? Which one did you like on those studies? How was that done? Where was it published? Thank you very much. And but you don't have to rely upon the United States, because the United States is kind of an interesting place anyway. We do studies for money. And so the World Health Organization collects data for fun. And so they collect tooth decay data worldwide. And so if you take all of the countries that are responding to the World Health Organization tooth decay surveys, what you find is, can you pick out the countries that fluoridate their water in that graph? Is that tooth decay used to be really high, and if you wanted to extend that line further back, I think the back area is what, 1940? And if you want to go back to the middle of the Depression, it was highest in the Depression. What happened during the Depression? Wasn't there a shortage of food? Malnutrition is the cause of tooth decay. And so, since we now have refrigeration and we have gobs of food that we throw away in dumpsters every day at the supermarket, that there has been a steady decline in tooth decay worldwide, despite an increase in the amount of sugar that's eaten. And that the decline has been steeper in countries that don't add fluoride to their water supply. So show me the evidence that this is a benefit, and why are we putting in fluoride-releasing fillings, fluoride sealants, topical fluoride treatments? Has the FDA approved that? And the congressional investigation of 2000 determined that no, they had never approved any fluoride-containing substance to be ingested. So if you're writing a prescription, maybe you live in a non-fluoridated community, and you wrote a prescription for fluoride. I did. I wrote a prescription for my nieces and nephews who lived in Oakland. San Leandro is fluoridated. Like, ah! And my sister-in-law, who's a nurse, thank you, and threw it away. She still makes fun of me. I didn't know that. So it causes dental fluorosis. The prescription fluoride, I asked the people that sell it to give me the evidence that it's beneficial. And they sent me a study by Peebles that showed that 66% of the children that took the fluoride vitamins had dental fluorosis of one tooth. 66%. So it's a tablet that causes good work for us, because then we can do the Lumineers. Good for business. The congressional investigation, the FDA replied after 2 years that fluoride, when used in the diagnosis, cure, mitigation, treatment, or prevention of disease in man or animal, is a drug that's subject to FDA regulation. I've had dentists say it's not a drug. So, can you say liar, liar, pence on fire? So, in 1975, the FDA rejected one application for fluoride vitamins, fluoride. And they, at the same time, allowed 35 new drug applications to be, quote, voluntarily withdrawn. So 36 times so far, the FDA has given back the product to the manufacturers and saying that no evidence, no substantial evidence of drug effectiveness as prescribed, recommended, or suggested in the labeling. So that's exactly the same statement can be made about drinking water fluoridation and cements and composite fillings that leak fluoride and varnishes. So this is one of my embarrassing moments that turned out okay, that the girl is 14, and you can see she's just about got all of her permanent teeth in. She had a little delay in her cuspids coming in, which is typical of a fluoride-exposed child. The cuspids end up high and in the buccal fold, and so it's really good for orthodontics. It causes crooked teeth. So the number of orthodontists, the dentists like to say, oh, tooth decay's gone down, it's got to be the fluoride. Well, the number of orthodontists has gone up. Why don't we make that the fluoride too? The size of my television got a lot bigger. Is that the fluoride too? The building's got a lot taller. Is that the fluoride too? Is that they're equating an observation with causation, and that is not how science works. But anyway, she got my chair, and I said, hi, how are you? Yada, yada, yada. And, oh, I see you got a little too much fluoride when you were a child. And she said, don't you remember what you told my mom? I knew you before. She was my patient when she was 3. And I asked her mother if she was giving her babies tablets of poison. because I had attended the International Academy of Oral Medicine and Toxicology by that time, and I knew that fluoride was a poison. So I asked her, are you giving your babies tablets of poison? And she had been, this girl, since she was 6 months old. And she went and got her, she said, you want to see my brother? And she went and got her brother. He had 2 months. He had a little row of spots on the edges of his teeth. So she stopped. How much of the tooth enamel is formed by age 3? Mother stopped. Child grew up. We could see the harm that was caused by her previous dentist's intervention. Actually, it was a pediatrician that prescribed it. So the FDA says at the present time there are new drug applications on file. There have been 3 different lawsuits on fluoride that ever made it to trial. All the rest of them are dismissed out of hand. The judge says, oh, you're not entitled to water that's safe to drink. It's not our responsibility to make sure that the water, it's somebody else's responsibility. You're a citizen. You can't enforce the laws of this country. That the Attorney General has to enforce the laws of this country. The city attorney has to enforce the laws. Somebody in government has to enforce the law. And if they don't enforce the law, you're out of luck. You don't have that right. You don't have what the court has called standing. But 3 different cases, they did manage to establish standing, and they managed to establish beyond a question of doubt. And these are called findings of fact. And these are facts that the courts determined in 3 different states, Pennsylvania, Illinois, Texas, that went lengthy trials. One was like 6 weeks long, and one was 2 weeks, and another was like 3. And that all 3 different lawsuits, oh, there we go, 14 days of testimony, 11 days, and 40 days. All 3 different lawsuits determined, finding of fact, that it exacerbated existing illnesses. Like, for instance, if you have kidney failure, do you know that people that have kidney deficiency, 14% of our population in the United States have kidney deficiency? You're not supposed to drink fluoridated water because it will accumulate in your body to high levels. So existing illnesses, that's not the only one, but I just mentioned that. Causes an increased cancer death rate. That's different than causing cancer. It does that too. But in this study, it was Dean Burke, the former head of the National Cancer Institute Cytology Division, took 10 cities that had added fluoride to the water supply and 10 cities that had not, and he tracked the cancer rate for a period of, I think, 20 years, both before in both the control and the fluoride-added city, and after, and cancer has been going up steadily since the 1950s, 1940s. Does nuclear testing cause an increase in cancer? Might. What country's been bombed 150 times with nuclear weapons? That would be Nevada. So cancer rate goes up, but when you put fluoride in the water, it rockets up. So that's the cancer death rate. That's different than causing cancer. We don't know if it caused the cancer, but we know that if you happen to die of cancer, you're more likely to die of cancer if you're in a fluoridated community than if you're not. And it contributed to excess cancer deaths. The finding of facts were never overturned. All 3 jurisdictions were overturned by higher courts based on standing. You can't sue the government because they got the Police Powers Act. If they want to shoot you, they're entitled to. They want to ignore the law and allow toxic substance to be added to the water supply that demonstrably harm the community, they're entitled to. They the government. You see why the Texans all want to keep the guns? The American Dental Association likes to brag. It says no court of last resort has upheld any lawsuit against the practice of fluoridation. They're right. It's true. They haven't. Our courts have not protected us. But if you look at the dose exceeds the dose that's known to harm. So I can prove to the court that this practice is harmful. I just can't get the people promoting it to stop. Because the people that are promoting it are dentists. The public didn't go out and say, boy, I'd sure like to have some silico fluoride from China in my water. I'm just so hungry for some more hazardous waste from Mexico. By the way, there is one dentist that said it's been purified. I said, oh, how do they do that? And of course, she said, oh, I don't know. They don't purify it. It's untreated. Raw, untreated hazardous waste. I was in Modesto at a conference, and we were discussing fluoridation. And that the public health department, who make their living promoting it over here, and me and a guy with bad kidneys, and a guy with a physician, were over here trying to suggest that Modesto shouldn't put it in the water. And I said, let me give you an example. There's a disorder that some children are born with called diabetes insipidus. And that means that the child, instead of drinking 1 liter of water a day, is going to drink 4 liters of water a day, or maybe 8 liters of water a day. They basically consume vast amounts of water because they don't have, not producing antidiuretic hormone. And you know what it feels like to not have enough antidiuretic hormone if you've ever had about 4 beers. Because you can have 3 and you don't have to run to the bathroom. But the alcohol inhibits the production of antidiuresis, and after about the 4th beer, that you can't stay out of the bathroom because your body's not conserving water. Well, there is a disorder called diabetes insipidus where some babies are born with that. And so there's no problem, just feed them lots of water. And so if you're making formula up, it's more than the mother can produce with breast milk, so you're feeding them formula. And I said, so what are you doing to protect that baby? What are you doing to help that baby? And the nurse from the public health department chimed in, well, hopefully that baby will die before it's a problem. And you know how they have the thoughts that occur to you the next day that you wished you'd have said? Had I been thinking, I would have said, Nurse Kevorkian, I didn't recognize you. So once you put it in the water, it ends up in everything. And so we've measured stuff. And so it's at 3 parts per million in Gerber's graduate berry punch. Now, how did it be that high? You know those planes with the 2 wings? What are they spraying? Well, pesticide, right? Well, what's in the pesticide? Cryolite. Well, what's cryolite? Sodium aluminum fluoride. Well, how does it end up in the grapes? Well, you know how grapes are nice and sweet and flies like to come and land on them? Well, if you fly over, all the flies are dead. And the fluoride ends up in the grape, that's end up in the children's juices. It ends up in everything that the airplane flew over. It ends up in foods that are concentrated, like Wheaties is in there because it's in the water that they concentrate the food from. And then if you happen to get anything instant, whether it's instant coffee, instant tea, instant anything, instant means it's been dehydrated. And so instant Lipton iced tea has high levels of fluoride. And there's even a recorded case of a lady that developed crippling skeletal fluorosis from drinking her favorite beverage is iced tea. And so skeletal fluorosis looks like that. That's what she looked like. Her doctor was smart enough, study is White, is the name of the guy. He picked that up in an x-ray after she complained for years about lower back pain. You know where the fluoride accumulates? It accumulates in the lower back. How many people do you know that are of small body size that have lower back pain? The smaller you are, the smaller your bones are, particularly women because they have smaller bones. Your body has no known use for fluoride, and so if it can't get it out, only half of it leaves through your kidney. The rest of it stays in your bones. And so it accumulates in specific joints and lower back. And so you end up with joint pain, we call it arthritis in this country, 60 million people. Lower back pain, another 60 million people. So when the dentists say, I haven't noticed any problem, I said, have you looked below the chin? This fella inhaled the coal dust from barbecue. He was dehydrating corn. And if you look at his legs, he can't walk. He looks unhappy because he can't walk. This is from my video. He can't bend his head sideways. She can't stand up. She is happy that they got the fluoride out of her water because she was paralyzed on the bed and couldn't stand up. They got the fluoride out of the water, and now she can stand up, but she has to lean on a rock, brace her leg on the rock so she can see who she's talking to. And if we had her statements translated, and she's praising the doctors that are with me. Oh, thank you, thank you, thank you. Thank you for taking the fluoride out of the water. The pain is so much better. I can walk now. I can move out of my house. Thank you, thank you, thank you. Thank you. I'm grateful. I thank you. Relative toxicity is that fluoride is more toxic than lead and a little less toxic than arsenic. Just like lead, it accumulates in critical organs and it affects IQ. Do you think your patients would thank you for taking a couple of points off their child's IQ? Couldn't get into Yale, but I got into Harvard. But that's what happens to the graph when you knock IQ down. You lose your genius. You got people that can run a broom. You got people who can drive a bus. You got people who can be dentists. But you don't have people that can come up with the solutions to the Earth's problems. High fluoride in this study was 4, and the low one was 0.9. Oh, and some people say, well, they've lowered the level of fluoride in the water. Actually, they haven't. They lowered their recommendation to the lower limit of what they used to recommend. They have always said, since day one, the optimum level is between 0.7 and 1.2. And then when 40% of the children nationwide, averaging the children drinking non-fluoridated water and the children drinking fluoridated water, you know what we say about that? That's called cheating, because you muddy the data, and that's one of the techniques you use to make issues go away, is you mix your data up. It's inappropriate to mix a child that was not exposed to fluoride to a child that was exposed to fluoride and then report the overall percentage of dental fluorosis. Doing that, it's 40% of the children have 2 teeth harmed visibly. And so they're going to say, well, we now recommend that we only use the lower level. They will not face the issue and recommend no fluoride, which is what I recommend. The adverse effects are cancer, dental fluorosis, hip fractures, thyroid suppression, stomach upset, and neurological impairment. One more quick story, and then I'm going to, now that I've taken away your favorite way to stop tooth decay, I'm going to give it back. A new technique that works better than what you've ever had in your entire clinical practice. We were on a bus leaving Offenhausen, Germany, where Boyd Haley, myself, Mike Ziff, Murray Vimy, and the crew from the academy blew Germany out of the water for the 3rd time. And so Germany on the issue of mercury in fillings. And we're on the bus, and I happen to be sharing a seat with Boyd Haley, and he's sitting there holding his stomach and eating Tums. And I said, oh, God, an Alzheimer's researcher taking aluminum. Where's Alan Funt when you need him? And Boyd said, you know, I got this terrible heartburn. And I said, oh, I bet you brought your fluoridated toothpaste from the United States with you. And he said, well, Colgate. And I said, well, you're the chemist. Tell me this. What happens when you take sodium monofluorophosphate and you drop it into hydrochloric acid? He said, well, you know, you get hydrogen fluoride. And I said, would hydrogen fluoride burn a hole in your stomach? He said, yeah. And would it quit burning if you put aluminum on it and created aluminum and calcium fluoride? Well, yeah. And I said, well, take some more. He threw out his toothpaste, and he and his wife both got rid of their long-standing problem with heartburn. You want to know how many people have heartburn? When you're in the checkout line at the grocery store, turn around like this and see how many stomach aids they've got there and read what their ingredients are. They mitigate fluoride. So now that I've ruined your fluoride program, let me tell you what happens. Is that fluoride is not even lethal to the germs. Understand, you will learn this afternoon, hopefully, in our biological perio program, standard medical care. If you go to the emergency room and you've got a purple finger, they figure out the name of the bug that's infecting that finger, if they don't cut it off, and then they give you something that kills that infection. And the first thing they do is they start painting the wound with iodine, because iodine kills on contact. And this lady, this is Dr. Lopez at the pediatric, she's a physician, but she got tired of the babies coming in with baby bottle tooth decay. And she dabbed their little teeth 6 times a year. How often do we tell them to brush? every day. So instead of twice a day, instead of 700 times, she did it 6 times. And it had a huge reduction in the amount of anticipated tooth decay. Dabbed it. You know, Q-tip. These are rabbits. You know, they're 1-year-old babies. And these were babies that were engaged in, they said, risky behavior. I don't think babies engage in too much risky behavior besides going, pooping and peeing. But their parents might be engaged in risky behavior. And the tooth decay you see in children is because of bad feeding practices and a bug called Streptococcus mutans. And you can measure the level of Streptococcus mutans in anybody in 48 hours. They, in the test tube, put it in a nice warm incubator for 37 degrees, which is like you can set it outside here in Las Vegas. You don't even have to buy the incubator. Just set it out on the windowsill. And if it turns purple, they got strep mutans. And then you apply a disinfectant. I don't care if you use iodine, you can use colloidal silver, you can use anything that you like to. You can even teach them to brush their teeth and knock the scum off. Because in order to get a cavity, you have to have scum, it has to be the right kind of scum, and it has to have sugar. So you can starve it to death by taking away all the sugar, you can scrape the scum off the teeth, or you can kill it. And then you have them spit in the tube again to see if it still turns purple. And you do it again and again and again, and teach some other to do it until it no longer turns purple. And you measure it periodically. That child will go the rest of their life and not have any cavities. Or if they do, it's the middle one in the groove in the center of the tooth. And even the advocates for fluoridation say it doesn't work on the groove in the center of the tooth. Well, where are most of the cavities? In the groove in the center of the tooth. So, can you say, liar, liar, pants on fire? Calgary, Canada. That's the furthest point north my wife and I flew in our trusty little Skymaster. We've been as far south as Cartagena, Colombia. When you went to dental school, they taught you, how many people in here teach their patients to do the Bass technique of brushing? Come on. Hands up or down. You don't use the Bass technique of brushing? Are you teaching the Stillmans where you brush down on the uppers and up on the lowers? Let me ask you, if you're going to brush your fingernails, you're going to get the stuff out by brushing like that? The Bass technique of brushing, point at the gums and wiggle. Let me see again. Now that I've described it, the Bass technique of brushing is take a brush, point at the gums and wiggle. Arms up. Oh, how's it modified? How's it modified? How is it modified? So she's saying the modified Bass technique. Okay, she's saying she uses the modified Bass technique. And my question is, how is it modified? It's not modified. It's exactly like C.C. Bass described it. It's an insult to C.C. Bass to call it modified because that's what he described. But the ADA didn't adopt it. It was 1936. They said, you're a physician and we're dentists. And Dr. Stillman said you brush down on the uppers and up on the lowers and you will cause no harm. And Dr. Bass says, well, I have a microscope. And what I find is that you can't get the amoebas and the spirochetes out of the gums unless you aim the bristle at the gum. And if you use an ordinary Oral-B or a Colgate or one of those toothbrushes, they didn't work. You have to have 3 rows that are staggered in a pattern that doesn't allow any number of bristles to line up on one area because they'll put too much pressure on the tissue and it'll hurt. So you can't do the Bass technique with ordinary toothbrushes. You have to use a Bass brush. And then you aim at a 45-degree angle to the tooth and you cram it in there and wiggle. And I call it the cram and wiggle technique. And if I can get some help from my front row here, if you would pass out a Bass brush and if you already have one, make sure that it goes all the way around, and anybody that doesn't have one, have it. And the reason I'm pointing this out is that I didn't know this technique until Bob Barkley came to my dental school in 1967 and embarrassed the heck out of the school by telling us that germs cause tooth decay and germs cause gum disease. And my dental school didn't know that. They thought tartar caused gum disease. They didn't know. They thought sugar caused tooth decay. So a general practitioner from Macomb, Illinois, I think it's a town of about 7,000, had to get in his own little Cessna and fly down to Kansas City and tell them what was going on. Why do we have that kind of stuff? Why isn't this an ADA-approved brush? Because they don't make any money selling it. It's not got a patent on it because Dr. Bass wanted you to have it. He gave it to the profession so that we could heal people. He gave it to us because he cared about mankind. Well, who is this jerk, C.C. Bass? He was the youngest man to be dean of a medical school in the history of the planet. Anybody not get a brush? Hands in the back. Are we out? Well, that's all I could carry. I won't use, I'll write me a letter, I'll send you one. This is called POH1, Personal Oral Hygiene, POH. And it comes from a company in Oklahoma. Well, why does a company in Oklahoma make it? Because Dr. Jones was a periodontist, and he went and schooled under C.C. Bass, and he couldn't buy this brush. Dr. Bass taught him how to take a pair of pliers and an Oral-B 40 and pull the bristles out. Well, you know what? That takes a long time, and they got holes in it after they're done. So he bought a toothbrush making equipment, set up his company. It's called Personal Oral Hygiene, POH. So take the brush out of the bag, point it at your gums, smile, cram, and wiggle. It's not a brush, it's a cram and wiggle. And when you cram and wiggle, if you get any red on your toothbrush, you have gum disease, by definition. If I take this brush and rub it my hand, if blood comes out of my hand, that's not normal. The same is true of your mouth. There are vigorous tissues in your mouth that will resist any kind of bleeding. If it's bleeding, there's a bug eating the skin, and that's what it's doing. It's eating you for lunch, so don't let it. Teach your patients to figure out where it's bleeding, take a Q-tip, dab a little iodine on there, and kill it. Thank you for your kind attention, and we're going to take a break.